There are still many things we don't know about COVID-19, but the one thing that has become clear almost from the start, it's a much more dangerous disease for people with underlying health conditions. Thank you for joining us this evening. I'm Kimberly Hunt.
And I'm Steve Atkinson. From asthma to high blood pressure, there are any number of underlying conditions. ABC 10 News anchor Derek Stahl is going in depth on new data from San Diego County to look at which ones pose the greatest risk and why.
In the beginning of the pandemic, scientists thought of the coronavirus as a lung disease. But new data from San Diego County, combined with other research, suggests that this virus attacks much more than just the lungs. It starts when an infected person coughs or speaks. Virus particles go out and enter another person's nose or mouth. From there, the coronavirus heads towards the lungs, and the immune system tries to fight it, causing inflammation shown in yellow and green that can lead to pneumonia. For that reason, you might expect the most dangerous underlying condition to be a disease that affects breathing, like COPD or asthma. But in San Diego County, those conditions come in at number 6. Instead, the number one most dangerous underlying condition is high blood pressure, detected in 50% of the deaths in our county.
Almost half of all adults in the United States have hypertension, have high blood pressure, so 45%.
Dr. Abby Olalade with Sharp Reese Daily says people with high blood pressure often have existing damage to their blood vessels, and the same goes for people with diabetes, the second most common underlying condition at 35%. Based on early studies, scientists theorize the virus may be outright attacking those damaged blood vessels or causing more damage to the vessels through inflammation and clotting. But it's all theory at this point.
It'll take us years to figure this out.
At number 3, cardiac disease, seen in 31% of the deaths. These patients already have a damaged heart, and scientists have documented cases where the coronavirus appears to cause inflammation of the heart muscle. Dementia/Alzheimer's is the 4th most common underlying condition at 27%. One explanation:
people that have dementia have a high risk of dying from pneumonia. People that have diabetes have high risk of dying from pneumonia as well.
At number 5, chronic kidney disease, spotted in 18% of deaths. Scientists aren't sure if the virus attacks the kidneys directly or if the kidneys get hit with collateral damage from other body system failures. But regardless of the underlying condition you have, Dr. Olalade says taking steps to treat it and keep it under control can greatly reduce your risk. Take asthma, for example.
In people that have controlled asthma or mild asthma, they're not considered to be at risk of severe illness.
As of Tuesday, there were 626 confirmed COVID deaths in San Diego County, and 27 of them involve people with no underlying conditions. That's about 4%. Derek Stahl, ABC 10 News.
Obesity and a compromised immune system also made San Diego County's list. However, 2 conditions considered high risk by the CDC, they did not turn up in our local data: cancer and sickle cell disease. If you have a story that requires an in-depth look, ABC 10 News is listening. Send your ideas to tips@10news.com.